Our next speaker is Vivien Ho. Vivien is a partner at Pear VC, where she focuses on investing in human and planet health. She founded the Pear Female Founders Circle, supporting the next generation of female technical founders, and runs a 10-week program twice a year. Previously, she worked on executive business strategy, new products, and product growth for Airbnb homes and transportation, and was a consultant at BCG, focused on defining innovation and growth strategies for healthcare, consumer, and technology companies. She also hosts the Pear Healthcare Playbook podcast, featuring successful founders on discussing how they built a digital health business. Vivien earned an MBA in Healthcare Management and Entrepreneurship at the Wharton School and Bachelor of Science in Industrial Engineering at Northwestern University. Thank you so much, Vivien. I really appreciate you taking the time and being here with us.
Thank you so much for having me. I have a slide that I will share here. Do you guys see it? Okay, awesome. Well, excited to have a discussion. So if anyone has Q&A in the middle, happy to stop. But I have some slides, so we can get started. I'm really excited to be here to talk about healthcare and AI. Homa, thank you so much for having me. I had a presentation on what's in a good healthcare AI startup, and I thought it would be helpful for this group, given that I think I'm the only venture investor here, so I can give a little bit of perspective on our end, what we look for at the pre-seed and seed stages. So my background, I think we've already covered it, but here are some photos to support. I run a podcast called the Pear Healthcare Playbook Podcast. Really suggest folks, if you're interested in hearing about stories of successful entrepreneurs going from 0 to 1. That is our focus. And it's also meant to be a playbook for entrepreneurs and operators to learn how to, sell to payers, sell to hospital systems, and figure out what is the best way to build an MVP. I also run a female technical founder circle, which I'm really proud of. So if you are a female engineer or know a female engineer who wants to start a company, please let us know. We are excited to support them in their entrepreneurial journey. And yeah, I guess in terms of Pear, so what is Pear? Pear is a pre-seed seed stage fund, and I lead our healthcare vertical. At Pear, we invest in software and tech-enabled services, innovating on care delivery. We have our thesis areas on our website here, but broadly speaking, we invest in obviously healthcare AI, really excited about the immense opportunities to leverage new data standards and the abundance of healthcare. Our team, we have an AI team as well, dedicated at Pear, and we are very collaborative and work together on what is sort of the next wave of opportunities. And we also invest in other areas such as tech-enabled care delivery, healthcare tech stack, healthcare fintech, as well as pharma and R&D and commercial software. So really, really broad. What I love about my job is that I get to meet entrepreneurs and they tell me their ideas, and I get to be blown away by them. And we're thesis driven, but we're also excited to hear any new innovations coming out at pre-seed. Our vision at Pear is for aspiring change makers to value Pear as a healthcare partner to get from 0 to 1. And that means, one, helping to make commercial introductions through strong industry ties. We have a healthcare advisory council from bio and healthcare with over 24 advisors from the executive level, C-level executives and founders of biotech, healthcare, and life sciences, payers, pharma, and providers. And so we are really excited to help folks get from their first 2 people an idea to their first customer. We also help with recruiting your first hires. So we have a talent team dedicated in-house that helps folks hire their first 2 to 3 engineers, scientists, or even go-to-market and BD people. It really depends on what you need at the very earliest stages. Sometimes it's usually a software engineer, but we're excited to be really customized and help support founders in any way that they need. And finally, co-developing product strategy. So what we do from 0 to 1 is really figuring out product market fit. So what exactly is the company that you want to build that you believe there's a big market and there's also a customer that really wants it? It's pretty simple, but it's really hard to achieve. And so this is sort of a summary of our support to entrepreneurs is really focused on finding product market fit, go to market, recruiting your first 2 to 3 hires, and then eventually fundraising your Series A. And we continue to help companies after Series A. Our fund is meant to invest till the company goes public and support the company until they go public. And even after they go public, people come back, become LPs or become speakers. So yeah, it's definitely like a strong community, and we really pride ourselves on being the earliest investors in entrepreneurs. So going to like the meat of the content. So what makes a good healthcare AI startup? What we really look for at pre-seed is team and founder fit. So thinking through, I can go into details. And then the secondly is also problem and source of insight. So what exactly is your unique insight that you have that is going to help you beat incumbents? And finally, why now? And so a lot of it is, first figuring out, how do you build a multidisciplinary team? If you think about, deep tech companies or biotech companies, you really need the scientists and technology to be de-risked. We also want to think about who is going to be the one who is attracting and fundraising, who is going to be hiring folks, who is going to be selling to customers. So we really look for a team that not only has technology, but also complementary skill sets, such as maybe a clinician or someone who's really well-versed in go-to-market and has a lot of relationships, as healthcare is a space where you need to work with a lot of stakeholders. And if you don't have those people in your core team, then think about advisors. Like, how can you bring people around you? There's so many amazing people on this webinar that we can really think through, like, how do we best, deliver healthcare AI for customers? And finally, why is your team the best position to solve this problem? If this is a really interesting market, at one point in your company, there's going to be someone who's like, oh, that's a great idea, I'm going to go do that as well. So you got to think about what is like special about your team that is going to make you the strongest team to win. And that's, a lot of the secret sauce is the team and figuring out how do they grow over time and how do they continue to be curious and learning from feedback. And then secondly, insight. So really want to figure out what is your unique insight on a big hair on fire problem. And really this comes from lived experience or really intensive customer discovery, interviewing 100+ users and decision makers, and really figuring out what is the problem discovery before solution validation, right? You can't really sell a technology to a hospital system if you don't demonstrate how is it actually going to solve their hair on fire problem. And so I have a big part of this conversation about, how do we sell into different types of payers, pharma companies and providers, and figuring out what is important to them. And finally, you need the why now, right? Why is this something you could build now but not built before? Is there a technology paradigm shift? Is there a regulatory shift? And how does that make your product 10x better? Because sometimes if it's really obvious, the question is always like, why hasn't someone done this before? And so that's definitely one other thing is tailwinds, right? So this is like why we're all here today. Healthcare AI has a lot of tailwinds, which is really exciting. I think a lot of people already went through, exciting regulatory and news about healthcare AI, but on a broad sense, I'm really excited about healthcare because it's a huge opportunity. Healthcare is $4.1 trillion. It's 20% of US GDP, and it's growing at 7% CAGR over the next 5 years. And, that's a great number, but also a bad number. We don't want healthcare costs to be growing at 7% year over year. We also don't really love having, 20% of our economy in healthcare, and because that means like we're not potentially taking care, and you have to look at the patient outcomes, right? And I don't think the patient outcomes are really correlating to the cost increase. So therefore, there's a lot of opportunity to increase efficiency, improve healthcare outcomes, improve access, and innovate on care delivery. And a little bit of a summary. So, because I'm the venture investor, thinking through what is the current funding state, and looking back into the last few years, we see, we just put in the Q1, Q3 data in here. And we're landing out a little bit below 2019. Maybe we'll land around the same levels of 2019. And so we really have to think through like 2021, 2022 were peak founder-friendly markets for healthcare. And that's a great thing, but also, there's a lot of companies that weren't funded because they had good unit economics, or maybe they were highly valued and now they have to have a down round, which is not so great for the employees and not so great for investors. So just thinking through, like, this is the new normal, and we are actually, you know, we're not like a lot lower than in the last decade, but we are a lot lower in the last 3 years. So thinking through how that impacts healthcare and how that impacts, you know, founders. In terms of this, you know, I think a lot of people here are familiar, so I don't have to go into detail, but, you know, what I'm really excited about, you know, obviously OpenAI is really exciting, but I'm really excited about specialized models in healthcare. So, you know, Google's model scored 85.4% on a US medical licensing exam in less than 3 months of scoring 67.7%. So, and I spoke to their researchers there, and we have a researcher speaking later, which you can maybe go into, is that this number will continue to go up. And we're really excited that there really is an opportunity to apply LLMs in healthcare. And you know, this number is great, but it's not necessarily indicative of how it will perform in a real hospital system, given that a medical licensing exam doesn't really determine whether you're a good doctor necessarily. But I think it's a step towards the right direction. And an interesting part, which I don't know if many of you have seen this, but in their research, they also showed that AI currently answers you know, better reflects consensus than a doctor today. And, you know, we were always going to be harsher on technology than physicians, but there is, you know, even there is sort of a societal benefit to have, you know, potentially more physicians given the supply of physicians, and also over time we'll figure out how to remove the risk for inaccurate and irrelevant information. But I think this is a really exciting step in the direction of providing more access to healthcare. And then one interesting stat is, you know, if you look back in the last, you know, few decades, medical AI algorithms have been cleared at an unprecedented rate. So it's really positive for the industry. Less than 73 AI algorithms were cleared by the FDA in the last 2 decades. But in just the last 5 years, we've seen over 900 plus medical AI algorithms cleared by the FDA. So we're really lucky that our FDA is you know, interested in technology. And one other thing to kind of call out, and I'm sure you've seen this all over the news if you follow healthcare, you know, physician and clinician burnout is at all-time high, and we simply don't have enough supply of physicians. And there are a lot of reasons, you know, why this is, but I think, you know, one thing that we can focus on is how do we remove the top reason for burnout, which is physicians facing too many bureaucratic tasks with technology. But also, if you look at the third area of burnout, it's the increasing computerization of practice. So in the last few decades, we integrated Epic and converted medical records online. That might have added a little bit of a pain point if the technology isn't the strongest UX or strongest experience. But I think there's a lot of exciting opportunities to drive better user experience for physicians. Great. And so the next part is about you know, figuring out how to get healthcare organizations to adopt your technology. I've seen a lot of companies and worked with a lot of companies in our portfolio. We have over 30 companies in our portfolio, and they all sell to different players, and there's all, you know, different strategies. I wanted to break down sort of the strategies on 4 dimensions. Number 1, incentives, decision maker, decision speed, and business model, and try to figure out, you know, how do we figure out the incentives in healthcare and who is willing to pay. So the first one is provider clinics. So I see these as like SMB clinics. And, you know, they're interesting buyer for startups because they generally have fewer resources. They're more likely to have a need to invest in productivity tools, and they're often independently run or by private equity. And so they have less bureaucratic sales cycles. If you ever sold to a hospital system, definitely has more cycles than a small provider clinic. And so their incentives are often to increase profit margin, which means they're excited about revenue opportunities, cost savings, increasing gross margins. And they still have staffing challenges and interest in workforce retention. And the decision maker is often the clinic practice manager or the physician lead themselves. So that leads, you know, it's easier to find them. There's only one decision maker or 2 decision makers. And generally the business model is, you know, SaaS or lead generation or percentage transaction fees if you're billing or in the payment space. And that's obviously a broad generalization of an entire category, but I think it's an interesting go-to-market for a lot of startups because of the decision speed being a little bit faster than a hospital system. The second channel is hospital health systems. So hospitals are notoriously hard to sell into. They have thin margins. They have sensitivity to integration and clinical workflow changes, which makes sense, right? They're trying to make sure their patients are safe. They're trying to make sure their physicians are happy. There are a lot of stakeholders. As organizations get bigger, it becomes more bureaucratic. So their incentives are similar, but their pain point is more acute, given, especially in these last few years, the thin margins that these systems are working off of. And the decision maker is often a group of people, an executive council made up of a chief information or technology officer, chief medical officer, or physician representative, or hospital leadership team, or it could even be a department lead that is advocating for the technology. So definitely a really hard to navigate for startups. And really what I recommend here is making sure you have clinician KOLs and clinician advisors, or even someone on your team who will speak to the physicians, because physicians really appreciate talking to other doctors. And given the amount of bureaucracy at these large systems and the large impact a technology solution can have to the amount of integration risk entailed, they're known to have slow decision-making processes. But the caveat is also, depending on the priority level and level of innovation, the investment the system has, you might be able to crack through. And so you need to really kind of do some customer interviews to figure out, is this a number one top 5 priority for them? And if not, then how do we, maybe find a better customer to sell into if, we don't want a startup to die selling to hospital systems. And I wanted to note, we're investors in Viz.ai, and it's a great example of using AI to connect care teams earlier, to increase the speed of diagnosis and improve clinical care pathways, starting with stroke detection. And putting our framework into practice, health systems are incentivized to have better outcomes and also cost savings due to workflow time saved. And so, yeah, like I have a lot of slides, but I guess I don't know how much time we have left. How much time do we have left? 2 minutes. Okay. So anyway, we have a lot of this information online on the Pair Healthcare Playbook podcast. So if you would like to go through it, we have all the information there, but we go through each section, Medicaid, employers. Some people sell into 3 stakeholders, and that's pretty common for healthcare companies. This is one of our companies that's doing oncology decision support for hospital systems, and they are also focused on Medicare reimbursement. And then pharma, obviously really exciting. That's where I've been spending a lot of my time, is figuring out how to apply generative AI to pharma and improve R&D and also commercial. And we have a company here, BioAge, that is a good example of that. And finally, consumers, always the fastest decision maker, but never the long-term buyer of products. And then online, you can also see that, have opportunities in AI and healthcare that I've written down, but always adding to it. I think, I wrote this maybe 3 months ago, added a few more bullets yesterday night. It's really changing so fast. So really excited to see new applications and creativity in this space. And then we have, examples of different companies in here. Yeah, they don't have much time to go through it, but it's online. And then finally, like we work really collaboratively at Pair. So we're always thinking through what is our AI thesis. And currently we're really excited about specialized models for specific application workflows and use cases in healthcare, legal, fintech, and beyond. So definitely a good time to build a healthcare company if you weren't already. And yeah, we're, I guess leave it at, it's easy to put out papers with a headline grabbing a result, but does that tell you anything about how useful these models are in practice, and whether they can be in provider workflows, and whether they're safe and critical diagnostic applications? And so I think we have a lot of work to do as researchers, as technologists, as entrepreneurs, as venture capitalists, to make sure that we are, driving adoption in a sustainable and safe and aligned way. But I think, that's why we're in this business. We're excited and optimistic about the future and companies that will change this future. So yeah, I have a lot of slides, but I will just skip to the end.
Thank you so much, Vivien. That was excellent. I didn't know some of the things about the trends, of course, but because of time, I ask everybody who has a question, just put it in the chat box, and hopefully we can answer that there. Thanks, Vivien.
Thank you.
Thank you. Actually, Vivien's talk is going to be followed by a female founder,